Alright guys, forgive me, I was trying to do this live, and I was unable to get everything to hook up. We've had a hurricane come through here yesterday, knocked out a bunch of power everywhere. The internet connection hasn't really been the best since then. So I'm going to update you guys on the corona. I was cleared. Today is Friday. Was cleared to go back to work. And they said after tomorrow, which was after Saturday, October 31st. So I am cleared to go back to work. I'm going back to work on Monday because of how the work schedule falls. My symptoms are gone. Still feeling a little weak, but much better. I'm just going to answer some questions. Thank you guys for all the support. It was actually great to hear other people's stories about having the corona or the COVID as well. It was. I definitely know other people have the COVID and have the corona. I definitely know that for a fact. I've seen people with it, but just to hear other people is always encouraging. So let's go ahead and knock out some COVID-related questions that I got that were not related to the actual virus or the disease process itself. What happened with my children? So here locally, they're going some days to school, some days not to school. That day that I tested positive actually happened to be a day that they were not at school, so they did not get pulled. They were not tested. It wasn't policy that they had to be tested, but they had to go into quarantine with us. So my children came and they did quarantine, and then after we do quarantine, they actually have to go do their own separate quarantine. So they're actually going to miss 4 weeks of school, I believe, something like that. No symptoms from my children. I believe if they had started showing symptoms, they definitely would have been tested, but they never showed any symptoms. They were tip-top, running around like champs. So we were not required to test them. We were required to pull them from everything, which we did, and they've been in this house with us the whole time. So that's what happened with them as far as testing. Like I said, they didn't get tested, but they're doing our quarantine, and then they're going to do another quarantine. So they're actually doing, my children are actually doing 2 sets of quarantines without testing. But they haven't showed any symptoms, which is fantastic. They've just been running around like champs this entire time. Another question that came up was, I'm going to call it FMLA, Family Medical Leave. How did I get paid? Things like that. So I'm not sure if every single person falls into this category, but there is something called the Families First Coronavirus Response Act. It was designated by the government to sort of combat when someone goes into quarantine for COVID. It gives you 80 hours, 2 weeks worth of quarantine, payment. And I'm not sure exactly who doesn't qualify or who does qualify. I did qualify, and I had to go back and forth with my county health department and with my employer, and I've had to sort of fax and scan documents back and forth to kind of make sure that I was doing what I was supposed to be doing, and following up with who I needed to follow up with. So definitely, if you do test positive, let everybody know so you can get on board with that Families First Coronavirus Response Act. I could be saying it wrong, but that's excuse me, that's set in place by the government to help people when they are out of work, because this is going to take, if it doesn't take 80 hours, it probably take more actually, given the way that the time frame fell. I think it's actually going to take more than 80 hours, but you can't get any overtime. So I don't know what's going to happen with the other time, but we'll see with that. Another question that I was given, not really a question, was these like roadside testing facilities. We have them here. I'm sure that they're everywhere. I'm going to go ahead and say I would discourage them, and I would find a primary care physician, because these primary care physicians are already overworked. And just because you test positive does not mean that they are going to automatically call you up and say, "Hey, Chris, what do you need? We'll get you everything you need immediately." You're going to have to be your own advocate in this. Now, I did everything the way I did it because of company policy. And I'll get into my exposure and whatnot in just a second. But everything I did was due to company policy. I went to a primary care physician. I followed through with all of their orders and everything like that. Had I gone to just a generic roadside, maybe a Walgreens or something like that, they're not physicians. Now, they're going to tell you you're positive, and then you do with that what you do. But, excuse me, as far as getting medical help, you will only know you're positive. You really need an advocate. You really need someone. You need to be your own advocate and call up a physician and say, "Hey, I'm positive. What now?" Sometimes it's fluids. Sometimes it's meds. I was on meds. I'm not going to go over what meds I was on because everybody's kind of different. But be your own advocate. Don't just test positive and say, "Here I am." You have to do things yourself. And being a nurse, I kind of already knew that, but just seeing how busy the physician was with just my case, everybody's different. Be your own advocate. Look out for yourself. I can't stress that enough. You have to help you, especially with this coronavirus. They didn't check on me. Had I not, they just don't have time. They don't. I'm a nurse. I know they don't have the time. They don't have the manpower. You have to do it yourself. You do. They're not going to. As bad as that sounds, you have to be your own advocate with this for sure. If you're not getting better, let someone know you're not getting better. And you got to do it yourself. So let me hit that home. You have to do it. The hospitals are definitely filling up right now. You've got to do it. You have to do it. Just it's on you. Sorry to get off on that tangent. So anyways, I talked about the whole reason why I even got tested was from a very simple exposure. So you're seeing people now, and I saw it, I haven't been anywhere, people going into Walmart or Lowe's or grocery store, whatever it may be, just walking in there, no mask at all, and you have no idea who you're with. And I'm not going to force you to wear a mask, but I was wearing masks in public. I was wearing them at work. Everywhere I went, I was wearing masks. I wasn't a Nazi about it. I wasn't a mask Nazi, but I was definitely wearing a mask. And a lot of people are not wearing masks, I know. So I was exposed I was exposed, and the individual I was exposed actually later tested positive, and then because of that, I had to test. So at the time I was exposed, I was not actually exposed to a positive person. And then that's the whole reason why this even got, started. I was exposed, and then they tested positive. And they're like, "You know what? You were exposed to that person. You now need to test positive." And at the time of my positive, my temp was 97.8, and my pulse ox was like 98 or 96 or whatever it was, and I had no symptoms. And so on paper, you would not have thought I had it. if I was a non-masker, I wouldn't have even thought of wearing a mask, because I didn't even, was it the 6 feet for 15 minutes or something? I didn't even think that I had fallen under that category at all. I did not. Evidently, mine was long enough to, expose me, and I did test positive, and I did have it. But my exposure was not a great exposure. My exposure was not even a very long exposure at all. And it still got me. And like I said, at the time I was exposed, that person was not positive. So, it is what it is. And it definitely got me. So just by saying, oh, your temperature's, such and such, don't worry about no mask. My temperature was 97.8 at the time of positive. So can't really say that. Excuse me. The meds. Let's talk about meds. Like I said, I'm not going to go into what meds I was on, because of, really, it's just kind of like provider's choice. It seems like it doesn't seem like there's a go-to. Whereas if you got the flu, everybody knows what you're getting. This isn't sort of like that. Definitely, as I said, be your own advocate. You have to be your own advocate, because they're not going to just put you on meds when you test positive at Walgreens. And I will say that they definitely helped, as this is becoming more known of a multi-system issue, especially with coagulants, or anticoagulants, I should say, blood clots. You're probably already going to be sitting around a little bit more. You probably need something like that. Definitely, if your provider feels the necessary need for, do things like this. It is what it is. So, definitely look out for yourself is something to be mindful of. It's great to see that things are starting to get better, at least here at my house. But yesterday here in North Carolina was the highest we've ever had, and 2,800 or something cases, and so it's definitely getting bigger. The coronavirus is definitely getting bigger. So watch yourself. Like I said, I was not at all thinking I was positive, not in the slightest when I was positive. So you never know who's got it. Keep yourself protected. I can't make you wear a mask. I'm definitely going to be more mindful of, I was already mindful, but I'm going to be more mindful of touching my face, I think, especially out in public. Even though the cases are rare that you get it a second time, there's the possibility of it happening. Protect yourself. The best I can tell you. I hope it helps. I'll see you guys later. Hopefully get back to normal Monday. So, thank you much.